The HIV outbreak in southeastern Indiana has reached its peak and is now on a downward trend. In the past month, only 4 new cases have been diagnosed, bringing the total number of infected people to 174. Most of those cases have been traced back to Scott County, but that's not stopping other communities from taking action. As Barbara Brozier reports, as residents of Scott County learn to cope with the aftermath of the epidemic, the list of counties considering implementing needle exchange programs to prevent the spread of HIV in their communities keeps growing.
From here all the way down.
The marks on Kevin Polly's arms are a reminder of where he's been.
That's a scar from a miss that I had to go to the hospital.
And just how far he's come.
At the end, that's the only place I would hit was in my neck.
Most of Polly's life has revolved around addiction. He was living in the small, rural community of Austin, shooting up a prescription painkiller called Opana 4 to 5 times a day. With no jobs, no money, nothing else to do, it's how a lot of people in Austin were spending their time.
I was to the point, that's all I cared about. From the time I was awake till the time I went to bed, I was either using or trying to find something to use.
That vicious cycle came to a screeching halt a few months ago when an HIV outbreak hit southeastern Indiana. With so many IV drug users sharing needles, Austin was ground zero.
I got a letter in the mail, and I believe it was February, saying that it come from the Clark County Health Department, stating that someone had tested positive for a communicable disease and turned my name in.
Polly went to the health department to have a mouth swab done. The test came back positive.
It was devastating. At the time, I thought my life was over.
Turns out, it wasn't.
Very last thing I did before I left my house, one last time, shot up in Opana. And that's been the last time, April the 17th.
Polly checked himself into treatment in Jeffersonville, made it through the 35-day program, and is now living in a halfway house.
Feels good. I mean, I just celebrated 90 days clean and sober. I didn't think I'd celebrate 9 days clean and sober.
And things are looking up back home, too.
We have them come through here. We offer the same things that we offered at the other place.
The Scott County Health Department is settling into a new satellite office in the middle of the neighborhood hit hardest by the outbreak. Here they offer immunizations, HIV testing, insurance sign-up, and the needle exchange program.
They're really wanting the sterile water a lot. That's what Oscar asked for extra for, because a lot of them don't even have running water.
In the few weeks it's been open, this has become a popular place. We're here outside of normal business hours, but with the health department car parked out front, people keep stopping by for fresh needles.
You don't want them in the bag?
The needle exchange has connected the county health department to a population that's been underserved in this community. When they come in to get needles, they show the nurse an unusual bump or tell her about breathing trouble. And many of those people are finally getting help.
There's a lot of people that never would have signed up on insurance, that we signed up on insurance, that can now go to the doctor because they have insurance and they have that coverage.
While the outlook for this community was not good when the outbreak started, there's a renewed sense of hope on the streets. It seems the small town that felt left behind is now serving as a model for other communities throughout the state.
We've got in contact with several other counties. Some have come and actually toured the program and see how we ran it and things like that.
Several other counties have already sought approval for needle exchange programs or are considering doing so. An exchange in Madison County will go into effect in August. Fayette County has also requested an exchange, but it's unclear how the state will judge the success of the programs.
Indiana State Department of Health is working very closely with the Centers for Disease Control and Prevention to develop measures that to use to evaluate the needle exchange programs, to identify data points and a way to track data over time.
Clark County will hold a hearing next week to see what the public thinks about starting an exchange here, where the hepatitis C and HIV rates are 25 to 30% higher than the state average. That's worrisome to Kevin Polly, who's seen firsthand how quickly the disease can spread. He wants to settle down in Clark County, and he doesn't want to be living in another community consumed by an outbreak.
A year from now, I hope to have my own place here in Jeffersonville. There's so much more to offer here.
Good job with that story, Barbara. And we heard from Kevin Polly, who's been successful in rehab. Are others getting that same treatment?
Well, you know, Joe, they are being connected to mental health and drug addiction treatment, but the Scott County Health Department doesn't know numbers on quite how many people are actually getting that treatment and sticking with it. Those who do seek out treatment, though, they have to travel to the Indianapolis area or down almost all the way to Louisville, to Jeffersonville, to get into those residential treatment programs. The good news, though, is that Lifespan Mental Health Services, they're going to move into that building that the Scott County Health Department has recently moved into. So they'll be right in the heart of the outbreak, and people will have more access to some of those services.
You know, when you talk to people that have an addiction, they really have to make that choice to stop it. What made him decide to stop and get treatment?
For Kevin, it was really that HIV diagnosis. It was the worst kind of wake-up call he could have gotten, but he got that diagnosis and then he decided, hey, I'm going to go through treatment. He had a 9-day span where he was still using drugs before he went through with that. He said it was really hard when he first got to the program, but he has had no urge since then to use again, which is incredible. And
Polly is a big proponent of the needle exchange program. How do other counties going to go about to fund that?
Well, this law that allows counties to have the needle exchange programs, it does not have any federal or state funding tied to it. So they're trying to figure out how they can work with community partners, nonprofit organizations, and the CDC has been helpful, at least in Scott County, with helping connect them to organizations that will donate the actual needles that they can hand out.
Now, if we see more of these exchanges being implemented throughout the state, could legislation change at all?
Well, state legislators were pretty clear when they passed this very limited program where you have to have a public health emergency. It has to be approved by the state before you can start the program. They made it clear that's all they want. They don't want a statewide program because they don't want to encourage drug users to continue using. So they think this is the best plan of attack for right now.